Hello, everybody. My name is Dr. Konrad Sawicki. I am a second-year cardiology fellow at Northwestern University in Chicago. I'm delighted to be joined today by Dr. Dayna Johnson, who's an assistant professor in the Department of Epidemiology at Emory University, and also Dr. Fink, who's an assistant professor in the Department of Biobehavioral Nursing Science at the University of Illinois in Chicago. So would you say that healthy sleep is equitable in society?
Unfortunately not. There are actually quite striking racial and ethnic disparities and also socioeconomic disparities that we see in sleep health. And so, just to go into a bit more detail, we have data that shows that racial minorities, particularly African American, Latinx, Asian, Native Hawaiian Pacific Islander, and also Alaska Natives, tend to have shorter sleep duration, worse sleep continuity, and more sleep disorders in comparison to non Hispanic whites. And in general, we see that individuals of lower socioeconomic status are also disproportionately affected by poor sleep. And I use the term in general because we see that gradient between socioeconomimic status and sleep also varies by ethnicity. We see that among African Americans in particular, that socioeconomic status tends not to be protective in terms of good sleep health. And so, what that means is that we see worse sleep among higher income African Americans than lower income African Americans. And it's a very different gradient among non Hispanic whites. We see what we would expect, so that income is protected, and those that are of higher income in professional occupations have better sleep. But again, unfortunately, that is not the case for African Americans. We also see that sexual minorities are disproportionately affected by poor sleep. In general, if we're thinking about racial minorities and non Hispanic whites, there tends to be about an hour difference or more in sleep duration. And that's both among adolescents as well as adults. And then also, we see that the sleep disparities, they occur across the lifespan. So being exposed to poor sleep early in life, that is particularly more common among racial minorities or lower socioeconomic status individuals, tend to be on this trajectory to have worse sleep among adults as well. So it's really a critical point for us to address these sleep disparities, particularly among adolescents, and address this generational pattern.